When you come in for a treatment, my first treatment sessions are an hour and a half. The half hour is spent in getting to know you, going through your medical history, and slowly and gently trying to unravel what may be causing the symptoms that have brought you in. Nobody ever comes in to see me because they're doing just fine. Everybody comes in because they have a problem. And usually that problem is pain of some sort. We work back through the pain symptoms and try to figure out what the core is. My specialty, or my forte, is in fact working on the digestive system. I find that is the one system in the body that is, first off, exposed to the outside world other than your skin. It is the one system in our body that we change what we put into it on a daily and sometimes throughout the day basis. And we don't always choose the right things to put into this system. As a result, the digestive system gets quite a workout. Something to keep in mind is that the lining of your colon, which is the large intestine, changes the membrane every 3 to 5 days. Now that's phenomenal compared to the rest of the body that does not change at that speed at all. If any of these things start to go wrong, then the symptoms will show up, and we are trained as osteopathic practitioners to actually see what the problem is. So after a half an hour of assessment, we then start to get into the treatment, and I will go through various types of tests, manual tests, to find out what's mechanically not working. I will also use my visceral manipulation skills to find out if the organs are in fact involved, and I'll also use my cranial osteopathy skills to see if in fact the cranial sacral system is out of balance. Once we've figured out, I have a general idea and a treatment plan, if you will, then we proceed in that first session with a treatment. What's interesting is I am trying to move you out of balance initially. Currently, your situation is not working for you. That's why you come in to see me. And so many times people will leave after the first session feeling somewhat out of balance. And I always say that's a good thing, because initially the balance that you had was working for you, but it may not have been appropriate. So unlike, say, massage therapy, people don't leave osteopathy sessions feeling all warm and fuzzy. You sometimes will feel a little disrupted. And I usually follow up with a phone call within a few days to see how they're doing. And within 2 weeks, usually the next treatment will begin. I usually don't treat anybody any closer than 2 weeks apart. I'm not doing the healing. I am just moving your body into a place of balance, and then the body starts to heal itself. That's one of the core principles of osteopathy. So it takes a couple of weeks. Now, the exception to that would be, say, a motor vehicle accident or very extreme trauma. Then I would be maybe seeing the person sooner than that, but generally every 2 weeks. Osteopathy is not long-term. I don't see people month after month after month. What we're trying to do is find the problem, the core lesion, as we call it, work with that, allow the body to find the balance, and then to resolve and to heal itself. After 3 or 4 treatments, the person should be feeling a very different place. And I should also be at that point seeing different assessment results. And then usually what we do is sit back after 3 or 4 treatments. You might even give it a month or 2 at that point, and then follow up with one last treatment. And generally that's usually the end of your osteopathic experience for that particular core lesion.